We are diving straight into a frankly wild corporate roller coaster today. We're talking billions of pounds, massive national healthcare policies, major international trade agreements, and a sudden massive U-turn by some of the largest companies on the planet. Okay, let's dive into this because the shifts we're analyzing today, they're going to completely change how you view the tightrope between government policy and corporate cash.
So, the central mystery we're unraveling today is this massive, unexpected influx of cash that just flooded back into the UK economy. Almost out of nowhere, pharmaceutical giants are suddenly opening their checkbooks and pouring hundreds of millions of pounds back into British infrastructure. But to really grasp why this is such a shocker and how the UK managed to win back Big Pharma, we've got to look at the numbers.
Section 1. The £300 million return.
Let's start with the absolute powerhouse of Britain's life sciences sector, AstraZeneca. They just reactivated a massive £200 million investment specifically earmarked for their headquarters in Cambridge. Now, this isn't just some abstract figure moving around on a spreadsheet. This represents tangible, state-of-the-art laboratories. It means highly skilled jobs. It's a massive, real-world vote of confidence in the local innovation ecosystem.
And this brilliantly illustrates the compounding effect of corporate confidence, right? Because they didn't just stop at Cambridge. AstraZeneca simultaneously announced another £100 million in brand new funding for their site in Macclesfield. So right out of the gate here, we are looking at £300 million being injected directly into the UK's physical pharmaceutical infrastructure.
Sounds like a massive win, right? A booming industry doubling down on its home turf. But wait, here is the incredible twist to this whole story. If you rewind the clock just a few months, these exact same companies had literally packed their bags. I mean it. They weren't investing, they were fleeing. Which brings us to Section 2. Why Big Pharma walked away. To really understand the weight of that £300 million return, we have to examine the massive capital flight that completely shocked the industry last year. Consider this staggering number, £450 million. Just several months prior to this recent boom, AstraZeneca made the incredibly heavy decision to completely scrap a £450 million investment for a major vaccine manufacturing plant in Speke, Liverpool. They literally walked away from building a critical piece of national healthcare infrastructure. Now, what's really interesting here is how synchronized this exodus was. It's like a domino effect. Think about how this played out last year. Before September, AstraZeneca scrapped that Speke plant. Then, in September, they suspended the expansion of their massive discovery center. But get this, they weren't alone. That exact same month, US drug giant Merck pulled the plug on a £1 billion headquarters in London. And Eli Lilly? They suspended part of a planned biotech innovation hub, all right around the exact same time. So we have to ask ourselves, why the sudden capital flight? What could possibly cause the biggest, most well-resourced pharmaceutical players in the world to all walk away from the UK at the exact same time? You just don't see a synchronized, multi-billion-pound exit like that by accident, right? There had to be a systemic trigger.
Section 3. The NHS pricing frustration.
This brings us to the root cause of the departure. It all boiled down to some very specific policy pain points between the pharma industry and the UK's National Health Service. Basically, there were two main industry-wide frustrations. First, the incredibly high cost associated with the NHS sales scheme. And second, some really strict curbs on the reimbursement for innovative medicines. From a purely operational standpoint, these specific pricing models were making the UK a highly unattractive business environment. Honestly, the companies felt penalized for bringing their cutting-edge medicines to the UK market.
In the scale of this problem, it absolutely cannot be overstated, which brings us to the number 8. Under the UK government's entire industrial strategy, pharmaceuticals is one of exactly 8 prioritized sectors. That's it. Just 8 pillars holding up their entire vision for future economic growth. So having AstraZeneca, Merck, and Eli Lilly all pulling funding wasn't just a minor speed bump, it was a massive, critical blow to the nation's core industrial strategy. So clearly, something had to give. The bleeding had to be stopped. And that brings us to the resolution of our story. The government stepped in and finalized a major deal this very month to fix the structural issues that were driving Big Pharma away.
Section 4. The US-UK trade deal. So the crucial point is the mechanics of the international agreement that changed absolutely everything. This is the exact quid pro quo that saved the day. The UK government agreed to spend more on new NHS medicines and, effectively, raise the prices of medicines in the UK. In exchange for swallowing those higher local healthcare costs, the US agreed to grant highly lucrative tariff exemptions on UK pharma exports. This ensured much smoother trade access to the US for these massive companies.
And you don't even have to guess if this was the specific trigger that worked. AstraZeneca explicitly stated that they, and I quote, welcomed the government's recent agreement to raise medicines prices in the UK. They tied their £300 million return directly, inextricably, to this specific policy shift. The government changed the pricing math, and the companies instantly unlocked the vaults. It's really that simple.
Section 5. Britain's Industrial Strategy.
Now that we've unpacked the specific deal, let's move to see how this builds a larger picture of modern economics. Because what we have just walked through is a perfect textbook example of direct cause and effect. Government policy literally drives corporate investment. The subtle tweaking of an NHS sales scheme or the negotiation of a tariff exemption across the Atlantic acts as a remote control for billions of pounds in local, brick-and-mortar innovation hubs.
But it also requires a very delicate, often really difficult balancing act. The government has to weigh local healthcare spending against its global industrial strategy. On one hand, they are now absorbing objectively higher costs for NHS medicines, which obviously impacts local budgets and everyday taxpayers. But on the other hand, by making that concession, they have successfully secured billions in priority sector investments, they've saved vital research jobs, and they've boosted their global export power. It is a strict, undeniable trade-off.
Which brings us to our final thought for this explainer. Is higher NHS spending on medicines the necessary price for fueling Britain's industrial strategy? It's a really complex reality. When a country wants world-class innovation, local laboratories, and a booming priority sector, well, someone ultimately has to balance the books to make that environment attractive. Definitely think about those behind-the-scenes trade-offs the next time you see a massive corporate investment announced in the news. Thanks so much for joining me today, and keep questioning the mechanics behind the headlines.